Hey, hi. Oh, okay, hi. These are from the Obama folks. I'm ready to get started. At least all the main chairs are filled up. So there's a few more people who may be coming. I decided to have this meeting because it really struck me as sort of part of my, the first duty that one of the first political duties that I've been aware of since I was a little boy is a duty to vote, which I've taken to heart ever since I could. But really remarkably, I think, in the aftermath of this last election, it's the first time I ever remember being explicitly asked over and over and over again to provide some input. I'm very dubious of what will ultimately come of it, but I think it's something that we ought to at least give them a chance and take them seriously, that they really mean it and want some input. And in our own small way, I think we ought to try to do it. I conceive of this as sort of a dreaming exercise, an idea where we might get together and share a few thoughts that aren't so focused on every specific detail necessarily of what we want in a healthcare system, but what kinds of things are important to us, what it is we want when we interact with the healthcare system. And in this room are people who have different perspectives. I think all of us are patients. Some of us are doctors or nurse practitioners or other practitioners in the healthcare field. Some are involved in the business of healthcare here, and so there's a lot of different perspectives, and I thought that we might bring those perspectives to bear, and try and come up with some thoughts that somehow could get synthesized, and I don't know, pass them on.
I'm here because of my concern about the healthcare system. I feel that since Nixon passed the HMO Act, he's introduced middlemen into our healthcare system, which is one of the prime reasons why everything's so expensive.
I'm Tom Gilmer. I'm retired, fortunate to have good benefits. I'm interested because I think the system has failed dramatically and is totally inadequate, and I don't like the direction we're headed, and I'm not sure I'm smart enough to figure out a better one.
My name is Julian Torres, retired union activist. I, like many of us Americans, feel that healthcare should be a right. I think that we have some examples for that already set up with the Social Security system, the Veterans Administration. Those are some already set in place by the government.
My name is Carl Gerber. I'm retired also on Medicare and supplemental. I'm appalled by the inefficiencies in the current system, basically dominated by the insurance companies.
I'm Gene Powers. I'm a small business owner, and I have employees for whom I pay part of their premiums, and we cannot find good plans, affordable plans that provide good basic health care and pay for meds. There's a lack of equality and a lack of access of health care.
What I was hoping as sort of another phase of going through this is maybe if people could throw out little ideas of what they would like.
My name is Gail Herrick, and I'm a nurse, a public health nurse, and I work at San Francisco General. I've been working there for 20 years. I really believe the healthcare system is more based on acute care from the old days, and it needs to be more of a chronic care model, and that patients need to be required to maybe take classes in nutrition and exercise and their disease process, so they really understand, because patients really don't understand enough about what's wrong with them, and a lot of it is lifestyle and prevention. So that's where I'm coming from, not just throwing more medicine at people.
I feel that it needs to be taken out of the insurance company's hands and put it in government hands, so that you know, that all of us have an equal right and access to a primary care physician.
The biggest problem is that it's the insurance business, and it's the privatization business, and the for-profit healthcare system, which is what is eating us alive.
If I could wave a wand, I probably would somehow say, I want a solution that gets rid of the drug companies in turn helping me manage my life, and I want to get rid of the insurance companies. If I could just get a better solution to those, I think other things would happen, because the economic issue that's driving it seems to be coming from the insurance companies and what they're doing.
I want to keep coming up with the ideas of what we want to see. And I've heard universality of health coverage. I've heard about access, with the caveat that access means more than just having a card, that it means real access. I've heard about portability. I've heard a lot of talk about primary care as this particular focus in all of these areas. Other ideas of what people want, and it could be something, you know, some other real simple ideas.
I think restructuring the system such that providers have more time to spend with patients.
Time with your doctor, time with your provider.
As an employer, I would love not to be involved in my employees, selecting my employees' health plans. I want to contribute, but I would like to do it the way we contribute to Social Security, where for each employee, they contribute 7% to Social Security, and I contribute 7%. I would love to do that for healthcare, and then they can leave and go work for somewhere else and know that they can do that and have the same coverage and the same accessibility that they would have if they worked for me, and vice versa.
I think what he's saying is that the funding for health coverage comes from the employment situation. So that's the tax. But the coverage is regardless of whether you're employed or not. It would still cover, you'd still be covered if you're between jobs.
That's right.
One thing that would do is that would encourage people and payers to focus on primary care, because as an insurance company you can not allow certain people to buy your insurance by setting it too high or just simply not allowing them in.
So I want to go through the other items that are in here just to let you know what they are. There is a piece of legislation in Congress. It's called H.R. 676, which would fix the problem. Which would be a national health plan for everyone. A national health plan is not expensive. In fact, it's the only way to save money. The other thing that I want to make sure people leave the meeting with is a website. Change.gov is the Obama-Biden transition site. Go there, click on healthcare. They are soliciting stories. They also have other things where they're soliciting questions about healthcare. As it turns out, the leading questions right now in healthcare are all about single payer. And I think we need to push this. We need to help them understand that we really need to remove the profit motive, provide for primary care, you know, get healthcare done. What is it? Get it really, you know, liberal benefits, conservative, you know.
Make it accountable.
Make it accountable.
I don't think it's going to get there by taking little steps.
I
think it's going to
little steps. Little steps are just going to destroy incentive for change. But to completely revamp without truly revamping doesn't make any sense. The only way to save money is to get rid of the insurance. Bite the bullet and get rid of the buggy whips. We don't need any more buggy whips.
That's right. Roland, thank you very much for allowing us to have the opportunity.
Thank you for coming.